Hi, my name is Ellis Michaels, and I was diagnosed with Behcet's disease in 1997. In this video, I'm going to tell you about some of the different types of doctors that Behcet's patients typically see. Now, the first type of doctor that we see are primary care physicians. In the United States, and I should before I even get started, I should make it clear that I'm from the United States, and my experience is all with the United States medical system. So it might be different in Canada or England or wherever. But in the United States, most insurance policies require you to have a primary care physician or a PCP. Now, this is typically an internist, a family doctor, or just a general practitioner. This is the doctor that's going to write referrals to other doctors, to specialists. They might manage some medications, like my primary care physician takes care of my Eliquis, the blood thinner that I'm on. But all my other Behcet's related meds are taken care of by the next doctor on the list that I'm going to mention, which is a rheumatologist. Now, rheumatologists are doctors that specialize in rheumatic diseases. Well, what the hell are those? Rheumatic diseases are things like Behcet's disease, obviously, but also like lupus, multiple sclerosis. There's a huge list of basically most autoimmune type diseases, autoinflammatory diseases, arthritis, all kinds of stuff like that is what rheumatologists specialize in. They prescribe drugs like prednisone, methotrexate, biologics, immunosuppressants, sometimes painkillers, sometimes other drugs. Prednisone, if I didn't say that already, and other corticosteroids, stuff like that. And rheumatologists are the ones that will probably oversee your Behcet's care, even though your primary care doctor takes care of your overall, health, as far as any doctor in the United States healthcare system can take care of you. But rheumatologists will take care of your most of your Behcet's related stuff. I should mention, some people actually see either an immunologist or an infectious disease specialist or in addition to a rheumatologist. Personally, I have no experience with either of those types of doctors, but some people swear by them. But most of us with Behcet's see a rheumatologist. Another type of doctor you might see is an ophthalmologist. These are eye doctors, and one of Behcet's main symptoms is inflammation of the eyes, uveitis, and not everybody with Behcet's has it. Hopefully you don't. I did. I got it when I was 16, 17 years old, completely lost vision in my left eye. It literally happened overnight. Of course, it happened on a weekend. Had to call in a specialist who was on call gardening, and he didn't want to be there. But anyway, ophthalmologists are doctors that take care of any issues you might have with your eyes. Not to be confused with optometrists, who are also eye doctors, but they didn't go to medical school. Ophthalmologists go to medical school and either have MD or DO after their name, whereas optometrists have OD after their name, and they have to earn a doctorate as well, and they're very highly trained professionals, but they're not physicians. Next up, doctor you might see is a dermatologist. These are doctors that take care of skin problems, and Behcet's can cause a shitload of skin problems. I can't even begin to tell you how many different issues I've had with my skin over the years, from cystic acne to regular acne, bacne, folliculitis. I mean, I could just go on and on. But yeah, dermatologists are somebody that there's a really good chance you'll end up seeing. Behcet's, you probably know, that can cause, genital ulcers, but it can cause all kinds of other skin problems. It's funny, every summer when I get a little bit of a tan, you can just see all the scars, head to toe, from all the sores and stuff I've had all over my body over the years. Fortunately, I rarely get them anymore, but for like 10 years, it was just constant sores everywhere. It's horrible. Another type of doctor you might see is a neurologist. Now, there's something called Behcets, which not everybody with Behcet's disease has neurological involvement, but it can affect the nervous system, which, means your brain and your central nervous system. And if that's the case, you'll be referred to a neurologist. These are doctors that treat nervous system disorders. I've never been to one personally. Fortunately, I haven't had any issues with, I shouldn't say I haven't had any issues with neurological issues, because I have, but I haven't been to a neurologist for them. I've been able to, I've seen psychiatrists but not neurologists. And psychiatrists I'll talk about probably in the next video. I'll go over mental health professionals and other types of professionals that people say. I'm gonna mention just a few more types of doctors that people with Behcets see. Those are the ones that are probably the most common, or almost definitely the most common. But Behcets can cause so many different problems in so many different parts of the body that you could end up seeing any specialist at any time. But another one you might see is a gynecologist or a urologist, depending on if you're a guy or a girl, for problems down there, whether it be the genital ulcers or whatever. That's another type of doctor you might see. I see a urologist. Fortunately, I haven't had any sores down there in about 15 years, knock on wood. But I see a urologist for hormone replacement therapy, because all the meds I was on as a teen and in my 20s just fried my it's called the hypothalamic testicular pituitary axis, or I might be saying that wrong, but it's some HPTA axis. You just fried it, and my body wasn't making enough testosterone, so I had to see a urologist, who I continue to see twice a year. Another doctor you might see is an anesthesiologist. Now, I always thought these were just the doctors that put you under. I didn't realize they also take care of pain management. But I did learn that when I was in my early 20s, and I got referred to a top-notch anesthesiologist, pain management doctor in Boston, who we tried a few things and ended up putting me on methadone for a few years, which worked well until it didn't. But if chronic pain is an issue for you, you might end up going to see an anesthesiologist. You might. I'm not even going to try to pronounce this next one, because I mess it up every single time. I'm just going to say ENT doctor, which stands for eyes, nose, and throat. These are doctors that specialize in, that's right, eyes, nose, and throat. Behcets can cause problems with your eyes, nose, and throat. Cause I had some severe labyrinthitis in my left ear a few years ago, and my balance. I got up to walk, and I just fell right over. I totally lost my balance instantly. Fortunately, that went away over time. But also, tinnitus is common. I have it in both ears. There's a lot of reasons you might want to see an ENT doctor. I'll give it a shot. An otolaryngologist. Otolaryngologist. That almost sounds right. I'm almost saying it right. I've struggled with that one. Even when back in my paramedic days, when I first learned that word, I struggled with it, and I still do today, 20 years later. A couple more radiologists you might see. I've had to see a radiologist for a few things. These are doctors that perform and interpret various medical tests, MRIs, X-rays, CAT scans, PET scans, sonograms, ultrasounds, of which I've had 3 now. So you might, if you need to get some testing done, you'll see a radiologist. And I could go on and on. Gastroenterologist for stomach problems. Some people, I see a urologist for my hormone issues, but some people go see an endocrinologist, which is a doctors that specialize in the endocrine system, hormones, stuff like that. You might see a hematologist, which is a doctor that specializes in blood, like Dr. Acula. It's an old Mitch Hedberg joke. And, pretty much any other kind of specialist you could end up seeing with Behcets, because it can cause problems anywhere in the body. But those are the main ones. That should give you a decent idea of the type of doctors that we typically have to see. Now, everybody is different. Some people their Behcets is very, very mild. They might see a rheumatologist once or twice a year, and that's it. They never have to see any other specialists. Other people get bounced around from one specialist to the next. They see every doctor that I've mentioned and, 10 more. It all depends on the individual case. So don't get freaked out by this list and say, oh my God, I got to see all these doctors. That's just not the way it is for most people. Most people, you'll see, 2 or 3 of them. But I've seen a good chunk of them. But I've been living with this disease. I was diagnosed 25 years ago, so that's that. In the next video, I'm going to tell you about some other professionals you might go see related to Behcets, mental health professionals, and different things. And so thank you for watching, and I'll see you in the next video. Be well.